In investigations of arthritis, we will have a laboratory investigations and a radiology investigations. In laboratory investigations, blood tests can be useful in indicating the degree of inflammation and in monitoring response to therapy. The erythrocyte sedimentation rate is one of the best known inflammatory markers and indicates what has been happening over the last few days or longer. It is non-specific and influenced by many things including anemia. C-reactive protein responds more rapidly to changes in inflammation normally within days. A specific biochemical test which may be useful is for serum uric acid, which may be raised in gout, although it may be unreliable during an acute episode. Many of the inflammatory arthropathies are associated with increased levels of a number of autoantibodies, although their significance isn't always clear. Tests for rheumatoid factor and the more recently used anti-CCP, anti-cyclic citrullinated peptide antibody test, for example, are both often strongly positive in patients with rheumatoid arthritis. However, rheumatoid factor may be also positive in other disease states and in the elderly, and is therefore not highly specific. It is also important to consider infection as a cause of an arthropathy, particularly in the case of a single joint. Blood cultures for infection should be taken even if there is no fit. A synovial joint fluid analysis is a group of tests your doctor can use to diagnose problems with your joints. Joint conditions like arthritis, gout, infections, and bleeding disorders can change how your synovial fluid looks and feels. A sample of this fluid taken during a procedure called an arthrocentesis can help your doctor figure out what's causing your symptoms. Synovial fluid analysis can help your doctor figure out if you have a condition that inflames your joint, like gout, rheumatoid arthritis, and lupus, an infection like septic arthritis, bleeding disorders like hemophilia or von Willebrand disease, a disease that outbreak down joints over time, like osteoarthritis. Your doctor will give you a local anesthetic to numb your joint. Then he will put a needle in and take some fluid out. How much depends on the size of the joint and how many tests you are going to have. Your doctor will send your fluid to a lab where a technician will do one or more of these tests. Check your fluid's color and thickness, measure chemicals like glucose, protein, and uric acid, see how many red and white blood cells and crystals your fluid has, tests for bacteria, virus, or other germs. If the results are abnormal, the synovial fluid may be cloudy or thick. A high white blood cells count could mean you have an infection or another medical condition. A high uric acid level and crystals could signal gout. A high red blood cell count could result from injury, blood in the joint, bleeding disorder. But the normal synovial fluid is clear, colorless, or pale yellow, stringy, free of bacteria, viruses, and fungi. A plain X-ray of the affected joint is one of the most useful investigations. Changes that occur on plain X-ray can be characteristic of a specific musculoskeletal disease, such as rheumatoid arthritis, osteoarthritis, and gout. Most changes occur over a prolonged period of time, and X-rays can therefore provide a useful historical record. Nowadays, ultrasound is becoming widely used, particularly in identifying early joint inflammation. Other investigations include magnetic resonance imaging, computerized tomography scanning, isotope bone scans. Treatment outlines of arthritis. Treatment of arthritis generally includes rest, occupational or physical therapy, exercise, drugs, and sometimes surgery to correct joint damage. Treatment of osteoarthritis generally can help relieve pain and stiffness, but the disease may continue to progress. The same was true for rheumatoid arthritis in the past, but newer treatments for rheumatoid arthritis have been able to slow or stop the progression of arthritis damage. In non-pharmacological options, we have to make a lifestyle modifications such as weight loss and daily exercise. And now, what about physical therapy? Physical therapist treatment has proven to be an effective treatment for osteoarthritis and may help you avoid surgery and use of prescription painkillers. Although the symptoms and progression of osteoarthritis are different for each person, starting an individualized exercise program and addressing risk factors can help you relieve the symptoms and slow the condition's advance. Your physical therapist may perform an examination to determine your symptoms, observe what activities are difficult for you, design an individualized exercise program to address your specific needs and improve your movement. Use manual, hands-on physical therapy to improve movement of the affected joint. Teach you aerobic and strengthening exercise to improve your movement and overall health. Design and teach you a home exercise program to improve your strength and movement. Teach you an exercise program for safe weight loss if you need to lose weight to ease pressure on your joints. Recommend a simple lifestyle change that will help keep the weight off. The physical therapist may use pain relief modalities such as TENS, infrared rays, ultrasound waves to relieve your pain. In arthritis treatment, the occupational therapy protecting your joints is an important part of arthritis treatment. With the help of an occupational therapist, you can learn easier ways to do your normal activities. An occupational therapist can teach you how to avoid positions that strain your joints, use your strongest joints and muscles while sparing weaker ones, provide braces or supports to protect your certain joints, use grab bars in the path, use modified door knobs, canes, or walkers. In pharmacological options, we will discuss oral and topical drugs used in arthritis. Number 1. Paracetamol. Paracetamol is a common painkiller. It can also lower raised body temperature, and it is used for relief of fever, headaches, the pain of arthritis, and other minor aches and pain, including pain from colds, flu, and period pain. It is thought that paracetamol works in the brain to prevent the release of substances that increase pain and temperature. Paracetamol provides relief of pain and high temperature within 30 minutes of taking a dose. Examples of brand names: Dimadon, Fibridol, Panadol, Panamax, Paralgin, Panadol Osteo. How it is used in arthritis. Paracetamol is usually the first medicine doctors recommend for relief of all types of musculoskeletal pain, including arthritis. Unlike ibuprofen and other non-steroidal anti-inflammatory drugs, paracetamol isn't effective in reducing the inflammation associated with arthritis. When taken regularly, paracetamol may help you to manage severe pain and can reduce the need for stronger pain medicine or non-steroidal anti-inflammatory drugs. This may help reduce the side effects from these other medicines. Paracetamol has a narrow therapeutic window, but in recommended doses, 1 gram 3 to 4 times daily is very safe. Paracetamol appears to reduce analgesia by raising the pain threshold predominantly through a central rather than peripheral mechanism. Paracetamol is usually taken by mouth in tablet or capsule form. It is also available as liquids and rectal suppositories. Most people who take paracetamol at recommended doses do not have side effects. Paracetamol doesn't affect blood clotting, worsen asthma, or affect the function of the kidneys. It also doesn't increase the blood pressure or increase the risk of heart attacks, but we have rare side effects. Stomach pain and nausea have been rarely reported, and allergy to paracetamol can occur very rarely with a variety of skin rashes.